Yeah. So the Aging Lifestyle in Blacks and Asians webinar is a sort of a unique platform which was founded in February as a measure to tackle and reduce health inequalities, particularly among immigrants like me and other admin members residing in the UK. Our vision is to advance health equity by engaging with the communities where we're from, the Black and Asian communities, through specifically health literacy. There are various similar platforms, but the uniqueness of our webinar, of this platform, lies in involving every one of you as co-creators of ideas, generating topics that could address specific health needs, and as well as inviting speakers from these ethnic backgrounds that engage with you all and during these webinars. So in essence, we do not just give out information or receive information, we also gain from your audience. So outside this webinar, we have an active WhatsApp community with members all over the world, including the UK, India, Nigeria, Ghana, Sierra Leone, Netherlands, Canada, Saudi Arabia. And we do hope that this is a platform that ensures all our members. We believe in knowledge exchange as a measure to improve literacy, because we are aware that where we are literate in terms of health literacy, we can build self-confidence and self-health empowerment. And our amiable team, as you can see on the screen, is made up of highly committed experts in different fields. And I will now call on Alosh Josie, the CEO of Cricket Cube, which is a community-driven cricket business based in Newcastle, to showcase our journey so far. Over to you, Alosh.
Hi, thank you, Fatia, and thank you all for attending. So we started our journey in 2023, last year. Yeah, time is just flying, isn't it? So we started in 2023, February, and then the idea was that we will have experts from different areas that we want to hear about come to our monthly webinar and talk to the community themselves. So this was idealized as a platform for the community members to know more about their health, and also experts and academics to engage with the community and then learn together as a group. So that's how we started. And then the first webinar we had, like I said, was in February 2023. And then this was delivered by a GP. So he is a GP, a very experienced GP with 16 years as a medical doctor based in Newton Aycliffe in the Northeast. So he was talking mostly about the general aging conditions, but specifically focusing on the Black and Asian community and what are the things that we need to do to counter these conditions. And then we moved on. So we were delivering webinars at the last Wednesday of every month. And the second one, we focused on physical activity. So one of the key things that came out of recent Sport England studies about ethnic minorities is that Black and Asian communities are the least active in the UK. Both communities, 60% of adults in both communities are inactive compared to 50% in white Caucasian group. So physical activity was critical for us. So the second webinar was focused on that. And thirdly, we had Dr. Fioma Danogosi talking about how to support senior citizens while ensuring that they have their autonomy. So this was a really important session for me as well, because as Dr. Fatia mentioned, we deliver cricket sessions in the Northeast, and we work a lot with older people. So this was really important to make sure that when we are delivering cricket sessions, we are not doing things for them. The idea was that just ensuring that we create the conditions that is really good for older people to do things themselves. And then we moved on to Dr. Khalid Ansari. He was an associate professor in the UAE, and he talked about chronic lung conditions, which was again very pertinent in our communities as well. And then the next webinar was actually delivered by one of our own admin team members, Dr. Zheng Ma. So that was really good to have him speak. about iodine deficiency in the Black population. So nutrition is a key part of obviously aging well, and due to a number of reasons, this has not been a focus area for many of us in the community. Because until that webinar, I wasn't really sure about what I didn't need was how was needed and what's the consequences of not having it. So that was really important, even for someone who's slightly younger, to know what we can do. So the webinar series was never focused specifically on one thing. So when some of our community members, some of our viewers want to learn more about digital technology and digital wisdom. So we made sure that we had someone cover those topics. So we had Apurva Jain from the UK National Innovation Centre for Aging in Newcastle talk about how technology can be harnessed well within our communities, within the older adults in our communities. And then we had Temiola Adeni, who's a public health researcher in University of Bristol, talking about STI testing and services in the Black community. As we all know, both the Asian and Black communities could be quite reticent to talk about things like that. So it was quite important to have someone from the community itself coming and talk to the community members about the importance and the needs of STI testing and how this can be done in the UK and also across the globe. So that was a really, really important session for me as well. And then finally, we had Dr. Janet. Again, very close to our admin team. So she delivered a session about cervical cancer among Black, Asian, minority ethnic women. So again, it can be considered as another taboo subject within our community. So it was quite important to know what are the steps taken within the NHS and what are the steps to be taken further to make sure that cervical cancer screening happens as much as it can within the communities. So that was our that's what we did as a webinar. So after that, after 1 year, wasn't it, Fatia? Slightly more than a year.
February 2023.
Yeah,
That's when we launched it. Yeah, so
yeah.
over a year now.
Yeah, so over a year, we finally moved to an offline setting. So that was really, really wonderful. So we had our first annual Congress. So I will stop now. I just have the tendency to keep talking. And invite Dr. Giselle to talk about the Congress and the rest of it.
Thank you, Alosh, and thank you everyone for being here today to listen to what we refer to as the first ALIBSA annual Congress that was held in Bristol this year. The theme of the Congress was stakeholders engagement, and we had the following agenda that I believe Dr. Adesope would like to talk about before I explain the main findings of the research.
Hello, everyone. Thank you for joining us today. I would be taking us through the event of our ALIBSA Congress, which started with registration of our guests that came in during the Congress, and then we moved on to the welcoming of our guests as well, and community registering and knowing each other at that moment. And then there was a thing about community storytelling, which we have our keynote speakers, which I'll be showing you the names of our keynote speakers and their organizations in the bit. Okay, this is the ALIBSA Stakeholders Congress, which featured presentation from keynote speakers from notable organizations across the UK. We had Uda Ajnon, who happens to be the director of Cafe Health, and she was able to take us through the event to explain things to us about what has been going on in our organization. We met Daniel Edmond, who happens to be the chairman of BEMSCA, and Lily Kanda, who talked to us concerning Voice for Her, basically about women. And then Nadim Ahmed, who was a keynote speaker, who talked us through Never Say Never. And we had Judge Foster, who was a publisher, and we had Dina Berry from Sirona Health as well. And then we had several sessions, which was about writing things about your organization, people that attended to write things about the organization, the job title, mainly. So it's more about introduction and to have the data of people that came for the Congress, that attended the Congress. So, and session 2, we had a session 2, which was about writing, and discussion was about 5 common age-related health issues you or your family members experience. And this will be taken from talking about the outcome at the end of the day. Dr. Giza will be taking that in a bit. What are 5 common barriers you or your family members face when assessing health services? We talked about that as well. We discussed that, and data were also put together. What are the 5 common barriers you face as a service provider when delivering health services? Ranges of ideas were brought up towards that, and then we put all that together, which will be taken by Dr. Gizel. The main findings by Dr. Gizel, who is a global health professional, will be taking this part of the presentation. Thank you, everyone.
Thank you so much, Dr. Adesope, for running through the event. I will now be explaining the main findings based on the sessions that we had. Throughout the event, we had 45 attendees from diverse organizations. From the health and social care, we had people from the NHS, from Age UK, Bristol, from Sirona Healthcare. From academic institutions, we had people from UE Bristol, Bath Spa University, Coventry University, the Montfort University. From community-focused organizations, we had Bristol Older People's Forum, we had Cafe Health, and we had a lot of other independent and smaller community initiatives. About the ethnic distribution of the attendees, we had about 29% of our attendees were white British, 26% were Black African, 7% were Black Caribbean, 10% were Asian Chinese, and then we had white European, Asian Indian, Asian Pakistani, Asian Bangladeshi that were all represented during this this Congress. And we had a few other little groups. Based on the first session, which was, based on the second session, which was discussing 5 common age-related issues you or your family members experience, we had the majority of participants spoke about cardiovascular diseases. We also had mental health issues, which came closely second to cardiovascular diseases, including dementia, depression, anxiety, loneliness. We had musculoskeletal diseases, including osteoarthritis and other joint issues. Diabetes came closely behind that. And then cancers, particularly men's cancers, that was raised as one of the common age-related health issues faced, and a group of others. The common barriers to access healthcare, the first and the most raised common barrier by participants was the lack of GP appointments and the long waiting list that we experience here with the NHS in the UK. Secondly, we had poor communication between the healthcare services. After that, we had language and lack of cultural understanding. We had exclusion and digitalization of services, especially with the NHS app, and the difficulties with accessing this, especially with people who are not very used to the digital accessing healthcare using the digital method, which is more common now. And then we also had the disjointed system, which is basically the uh, lack of collaboration between secondary care services and GP practices that prevents people from accessing the right care at the right time. Finally, we spoke about the next slide, please. Finally, we spoke about the barriers to delivering healthcare services. That's the barriers the participants as healthcare providers faced while delivering healthcare services to the communities in which they were involved in. And the most common was funding limitations and short-term funding. Most of the participants spoke about the funding limitations that they faced, and the fact that they received a lot of short-term fundings that could not result in a significant and meaningful impact in the community. There was also difficulty in accessing and engaging with the target audience because it was difficult to integrate the community. There was lack of diversity in their own, like the next one was the lack of diverse and adequately trained staff. So this was in line with the difficulty in accessing and engaging the target audience because of the lack of diversity and the fact that people could not see themselves in the service providers. Another very important one was cultural and language barriers, especially with minority communities, and the lack of collaboration between services. So I'm now going to pass the mic to Dr. Zengma, who is a senior lecturer in public health at the University of Bristol, who is going to talk about the key takeaways from the webinar.
Thank you, Giselle. Okay, yeah. I'm Chang, and then I will now talk about like the key takeaways for the webinar. Yep. So as we can see here, so there are 4 key takeaway messages, okay, that I would like to highlight. So the participant identify several critical points from the sessions, and the first one is community engagement and collaboration. So basically, based on this, we can see that there's an emphasis on diverse working approaches within the communities, and also the need for stronger collaboration and co-production to address these public health issues. And the second one is the cultural awareness and barriers. So we notice that there is importance of cultural awareness training needed, and there are also significant barriers to healthcare access for the Black, Asian, and minority ethnic communities. So this includes the language barriers and insufficient interpreter training. Yeah. And the third one is networking and education. So we can see that there is a value of networking and sharing the knowledge, especially within the communities, and also the importance of spreading the awareness and making information accessible, yeah, to the person who are using the services. And the last one is the organizational insights. So it's about learning the services provided by the ALIBSA and other organizations. And also there's need to increase awareness of the common issues across different regions, despite the income disparities that we have noticed. Yeah, could we move on to the next slide, please? Thank you. And also, there are some planned changes in behavior, policy, or practice. So our participant has proposed various changes to improve their practice based on the workshop. So there are 4 key changes here. The first one is inclusion and diversity. So incorporate the diverse patient voices when we are making the decision. And the second one is the proactive engagement. So we need to engage, okay, more proactively with the policymakers and the community groups. And we also need to reflect on the workshop and learning in organizational practice. And the third one is collaboration and training. So there's a need to increase the collaboration, especially with different organizations. And also, we need to think about how we can develop and replicate our ALIBSA work in other communities. And the last one is the education reforms. Okay, so decolonize the curriculum to include culture, custom, and ethnic languages. So this is quite important, especially if you want to see a change in the behavior, policy, or the practice. Yeah. Next slide, please. Yeah. So we also have some suggestions for fostering the collaboration following the workshop. So the participant provided insights on how we can enhance collaboration among the healthcare workers, healthcare providers, community organizations, and the policymakers. So there are 4 suggestions here. The first one is bridging the gaps. Organize similar events to bring stakeholders together to discuss and solve the public health issues. And also think about, to conduct the train the trainers workshop to improve their skills and knowledge. The second one is transparency and inclusivity. So there's a need to increase the transparency within and across the organizations, foster inclusion by inviting diverse stakeholders and community to the discussion. And the third one is community centered approaches, invest in community services and training, and also ensure that the decision making includes patient voices and consider wide health determinants. The last one is the networking and funding. So there's a need to create more networking opportunities within the communities and also organizations. And also how can we better secure continuous funding and engage commissioning groups in these discussions. Yeah. Okay. So lastly, the event experience and areas for improvement. We found that the overall event experience was rated very positively, with most of the participants highlighting the importance of having the networking opportunities and table discussion as the key enjoyable aspects. Yeah. And next, I would like to invite Toby Fatola, who is a doctoral researcher at UW Bristol, to talk about the conclusion.
Thank you very much, everyone. Sorry, don't mind me. Thank you thank you to all the team members who have actually presented one aspect or the other of the just concluded ALIBSA Stakeholders Congress, and thank you to all the attendees here present. You would agree with me that ALIBSA is actually doing something great, bridging the gap between, say, policymakers, service providers, and the minoritized communities. You talk about healthcare service, you talk about health literacy as it were. All these are actually aimed at a better life and a better understanding of what we are meant to do, even as minoritized communities. So from the just concluded ALIBSA Stakeholders Congress, well, our discussions actually spanned through discussing community health issues. Our focus was also on fostering collaborations between agencies present, right from service providers even down to the different age groups we have, targeted communities actually, and also creating a platform for knowledge exchange, because it's not enough to actually gather all this information, but also translate it into meaningful bits, which is helpful even to target audience. So also, participants, as we have been made aware, were not only academics, but also members of different organizations and also members of the public. So each of the category of people that were present at the Stakeholders Congress actually left with actionable points. The policymakers were able to draw out areas where their services has actually been lingering, what they can do to actually improve their services such that it's not aimed alone to a particular target audience, but it covers for all, including the Blacks and the Asians as well. So various organizations present actually took home various actionable insights and also gave the award to actually modify certain areas of existing policies such that members of the Black and the Asian communities get to enjoy privileges and services they offer much more better. And we are hoping as ALIBSA will be following this up in due time just to see the progress they have made so far. So ALIBSA is not just about talk, we are also doing the work. So we are not stopping at sharing the information. We are not stopping at just exchanging the knowledge, but we are following it up to ensure that people are actually able to actually translate it into usable bits as well. So moving forward, incorporate the feedbacks we actually got from the Stakeholders Congress as well. We are actually looking to actually implement it as well in our future presentations, such that ALIBSA can always get better. As we know, it is by daily improvements that we can actually grow and get better. So ALIBSA, we are not there yet, but we are on a journey, and we keep doing this, which is one of the highlights of the events of the ALIBSA Stakeholders Congress. But just before I do any other thing else, I'm sure that one or two, or even as many people as possible in the audience would have a question to actually ask with respect to the just concluded ALIBSA Stakeholder Congress. If you have questions, you can please signify, and we get to entertain it and shed more light and give you appropriate answers. And if you have comments as well, you can also share that even before we go into the second section of the webinar. Thank you very much. So you have the floor if you've got a question to ask, if you've got an input. Anyone?
Please feel free to ask questions related to the already concluded Stakeholder Engagement Congress. I'm sure you'd have burning questions. If you have any feedback, please feel free to share that with us as well. Like Toby said, we're not there yet. It's a journey. So what other things do you think we could improve on that would make our next Congress better off than the last one? So that is why we're here. We are here to hear from you as a community. We can't do it all alone. We are all co-creators of ALIBSA. So we need your feedback. We need your questions, and then we'll be able to address such questions as well. And like I said in the earlier part of this webinar, this is quite different from our previous webinar. We want to hear from you this time around. You've sent us on an errand, which is the ALIBSA Stakeholder Engagement Congress. We've fed back to you now. We need to get a feedback from you again. So we need your comments, we need your questions, and we would address your questions by providing sufficient answers to it. So please feel free to ask any question. You can put it in the chat as well, because we quite understand some of us may be multitasking. Please put your question in the chat box. Feel free to unmute your mic. Engineer, there's a comment from Engineer. So she mentioned, are there programs to educate menopause in minority women would be helpful? Thanks a lot, Engineer. We've noted that. Giselle, please take note of that. We have a long list of topics to deliver on ALIBSA, and we keep building on those topics. So now that you've mentioned this is really important. So we would add it to the list of our speakers. We are more than happy if you could also suggest a potential speaker that would deliver that topic in the NEO. I want to thank Indineo for joining this webinar. This is our first time here. She's a dear colleague from UWI Bristol. I would look forward to hearing from you. Please, we need more comments, questions, feedback.
Just to add to what Dr. Fatia said concerning the program to educate menopause in minority women, Lily Kanka from Voice for Her actually is has that organization that is addressing the problems that women face after menopause. That's between having full menopause, then the period in between. And yeah, she spoke a lot about it and what her organization does and plans to do with that regard. And women's issues was also like one of the main topics that or issues that was raised, like the fact that people couldn't really women were not listened to. And I think educating women on that and learning about the problems that women face, especially with regard to menopause, is very important. So thank you very much, Izinegwu.
Thank you very much, Giselle. I think Munira has a hand up.
Yes,
So
I was
we'll
just going to
recognize.
say, Voice for Her and Lily's work and looking at menopause, but also other things like incontinence and things like that increase, and that's related to earlier life stuff around women and everything. Just to say that nationally, I do a lot of work around women's health in general, and I chair a women's health task group of our Women's Commission, which was the work we did was very much used to do the National Women's Health Strategy. Now, I see that also from an intersectional lens with a race and gender hat on. And so there is a lot of stuff happening around menopause that's come up on. There are so many other
so
women's
I go
health
on
issues.
Stu Insights. Yeah, I believe I can find it that way. Yeah.
Sorry, someone's not on mute, but there's also lots of other stuff around women's health, particularly related to us aging and going on. So there is a lot of resources, and locally in Bristol, before Lily set up her organization, whatever, we did do some work like with Bangladeshi women around menopause and other work. So there is a lot of resources. So I suppose a lot of that is about bringing those resources and having those discussions, because menopause, incontinence, all those aging issues, men and women, there's huge stigma and taboos in our communities, men and women, regardless of our communities, just like mental health. And I've done a lot of work around mental health, and then the link with mental health and well-being, and a lot of these areas, very high in terms of menopause, the impact on people's women's mental health, you know, and things like this. So there is work going on, but I suppose this is a good opportunity through your network to link up who's doing what and get that information. So there is a lot of things, as I said, the National Women's Strategy is there, and there's a lot of things about women and aging and women's health. But what hasn't been done specifically is separate that out into the intersection of race. I mean, some things are obvious, but, you know, so that's, I think, the next stage. And that's something that Fatiha knows I'm very interested in and I'm involved in.
Yeah, thanks so much, Monira. I quite agree with you that there are a lot of resources out there, but the drawback we're experiencing at the moment is the uptake of such resources. You know, Monira, we are aware of these resources, but in terms of tailoring these resources to different ethnic groups, that's where the huge gap is, and that's where we're trying in our own little way as a network of like-minded people, to invite people within the community to deliver such resources in a tailored way to this the Black and Asian communities. I think that is missing. We do have huge, loads of resources out there. We know a lot of us do great works out there, but that holistic, tailored approach to suit the community is not there yet. So that's what ALIBSA is working on. I will keep in touch. I will be in touch, Monira, because we need people like you on this platform. We need you to move this forward. We need to reach out to this community. I think that's the essence of setting up ALIBSA. And thanks a lot for that comment. We have noted that, and I'll follow up on that, Monira. Thank you so much. I think Shan's hand is
Thank you.
well.
Okay.
Hi.
Thank you very much.
Hi, Shan. Hi, Shan.
Hi there. Thank you very much for the webinar. And I attended the Congress. I loved it.
Yeah.
And I was thinking what I really enjoyed was the community people giving some feedback and talking about the projects that they were involved in. And I was wondering, as we know, there's usually really good work happening, but people don't know about it. And whether at another conference or the next one, you could think about maybe areas of good practice, where that's happening. And if that could be highlighted, then organizations who are attending can really learn and make the connections with those who are actually getting it right.
Oh,
Thank you.
great. Thanks so much, Shan. You have noted that as well. We will consider that. Probably that could be our next theme, Alosh, right? Areas of good practice within different organizations. Thanks, Shan. I also want to mention Shan introduced a relative to ALIBSA team who is based in South Africa, who is also keen to, observe what ALIBSA does, if there could be a replication of ALIBSA model in South Africa setting. So we've got a lot of feedback, positive feedback, and the impact of the last Congress. We're looking forward to, more positive impact in the future. Monira, just to also answer your question, the slides will be available and the recording as well. And if you're happy to be added to the WhatsApp community, it's a closed group. We do not entertain unnecessary information. So please feel free to share your WhatsApp number with me. We will be more than happy to have you. I'm really conscious of time, and I do want others who did not attend the last Congress to attend the questions. So if you do not have any question, I think we'd have like a sort of 2 minutes break. I will call it break, but it's not break, but it's just to share our gallery view with you. And then afterwards, we would go to the next session, which is more about engaging the audience.
We'll also take the whole picture of the whole group as well.
Yes, that'll be the. Should we do that now, Alosh?
Yeah, I think we can do that
Okay.
now. Before
Okay. Okay, please, could you switch on your cameras? Toby, please stop sharing. We want to take the group picture. I can see we are 34 here. Can we all switch on our camera? We want to take a group picture. Thank you. Who is doing that? Is it you, Alosh?
Yeah, I'll take the picture now.
Okay, thank you.
You. I can get a
yeah, I don't think we can, but we can see 26 others there. Okay. Have you done that? Okay. All done?
Yeah.
Okay.
I've got the picture. Can you give me one more second just to see if we can get even more picture with the maximum number with a full screen?
Okay.
Yeah. I'll even take a picture from my phone as well. Thank you all.
Thanks
Thank
to you all. Yeah. So we'd have a short break. Thank you very much, Toby, for sharing that. So the next thing on the agenda is the activity session. I will start sharing my screen now. So we want to give you all, but especially those that did not attend the last Congress, the opportunity to attend the activities sessions as well. So this is not in person. So this is sort of an online one, but replicating the same questions. It involves using your phone. The link to the Menti will be put in the chat. Toby, Giselle, please can you add that to the chat so that everyone else would have the opportunity to access the Menti. You can all see my screen, but I need you to join or access these questions through the link in the chat. And then I will start presenting. So we have 3 questions for you today. When you want to log in, there will be a sort of a question about the link or the code. The code is 13951270. So I want you to think about the 5 common age-related issues you or your family member experience. If you don't know up to 5, just put in 1 there. 5 common age-related issues you or your family member experience. That will take a couple of minutes to get through. Giselle, can you log in and let's see if you would be able to attempt the questions as well, just to be sure there are no IT issues from our end. Okay, fab. So I can see diabetes, joint pain, arthritis, cardio. Cardio is a bit vague. Can we be explicit with what the cardio is? More of cardiovascular disease. Keep answering. We need more comments. So not just you, your family members as well. Cancer, yeah, I agree. Right, Alosh. Cancer is one of the top leading lifestyle-related conditions. Someone wrote eat flush. I guess that is linked to menopausal symptoms, but I'm not sure if that person couldn't access that. Let's take note of that. So we need more. So we've just had 6 people and we are 33 on this platform. If you could join, that would be great. We need data. We need your answers. We need your responses. Loneliness. Wow, that's a great one.
Breathing issues.
Yeah, breathing issues. Iron deficiency, particularly in women. So the password, Bishi, is 1395. So that's the password there, 13951270. So that's the password. You can take a picture of this QR code, move your phone close to, if you're using your laptop or your computer, you can take a picture of this and that links you to the Menti. So we've had 16 responses, but there are just 6 people that have joined out of 34. I will move to the next question because I'm really conscious of time. We have to end by 3:30. So the next question, thanks for all your answers. The next question is, what are the barriers you face when accessing health services? I understand that we are joining from different parts of the world. Majority of us are joining from the UK, but I know a lot of us are also joining from Nigeria. I know people are joining from South Africa. I'm not sure of the other, but wherever you are, what are the barriers you face when you want to access health services? Be it seeing a GP, a private practice, or a public practitioner. It depends on where you're located. But within the UK, we're talking about NHS. So what are the barriers you face when accessing health services? So it's the same code, 13951270. So we need your responses. You remember Giselle also, reported these barriers. These were from the feedback gathered from the Congress, but we need your feedback. We understand some of you joined the Congress, but who are still here, but we have noted that some could not join the Congress. So one is medicine prices in Nigeria. So the cost of getting health services is quite high in India. Language barriers, absolutely. GP long waiting list, I agree. So 2 people chose language barriers, then not many local doctors. More comments, please. Cultural barriers, absolutely. Miscommunication, and that is also linked to language barriers, absolutely.
Yeah. Dental treatment, I think, yeah, it's even in the UK, that's actually quite a big issue, isn't it?
Yeah. I can see Sue's comment here, technology. That's what most of our older adults struggle with. Even even
Especially
the Gen Z, or is it Gen Z they call it?
yeah.
They do. You can't compare with our older adults. My mom usually called me to sort out our phone issues from she's based in Nigeria. She still calls me over here. So I know that technological issues is one of the drawbacks. And how, I mean, this are something we need to really ponder on. In terms of the long waiting list is where we find ourselves at the moment now. We are looking at inviting a dentist in the future to talk about how to take care of our oral hygiene, because it's really important we know how to, have autonomy over our health, preventive measures to avoid dental caries. So yeah, so the next thing is, the next activity is, which is the last one, is in one word, how would you describe ALIBSA webinar? If you're a new participant, feel free. If you've been attending in the past, feel free to reflect on your past experience and tell us in just one word how you would describe ALIBSA webinar. And this is useful because we need to look at your comments and address how we could, make it better and make it more accessible as well. It is free. It's a free webinar, so the cost is out of it. But we do want to hear from you. I guess the first one is a highly important initiative. So informative. Yeah, we need more feedback. Just 4 out of 34 is really low. We need your feedback, please. The portal will still be open, but I want to stop here. Yeah, you could put your feedback in the chat. We'll be able to gather that as well. I want to stop here just to round up today's webinar because we are 4 minutes to the end. I will stop presenting now. Thanks a lot for your feedback and for your level of engagement as well. Toby, what's the next thing on the agenda?
It's talking about the next.
So I will, yeah. Toby, are you
Just
there?
a second. Yes, I am.
Okay.
Okay. Okay, I think. Oh, okay.
Yeah. So the next ALIBSA Congress is on the 25th of September. Same time, 2:30 to 3:30 p.m. Same link as well, and that will be delivered by Dr. Unduka Okwose, who is a researcher and an assistant professor at Coventry University, specifically cardiovascular and lifestyle medicine. He'll be presenting the topic Unlocking Longevity, tackling common age-related lifestyle conditions. So we do look forward to seeing you there again, and not just you. We look forward to you bringing in 2-3 people along with you. Please share the word within your network. Tell people about ALIBSA. We would look forward to, engaging with you further in the future. I would allow my other admin team members to talk if they have any questions or comments. I think I'll open the floor for them now. Thank you again.
Yeah, thank you all for attending. The webinar was a really, really important one because we had a lot of information, a lot of ideas, coming through our first Congress. So it's really good to discuss it with you, and also getting your suggestions and reviews and things like that for us to get even better. So thank you all for being here and being part of the ALIBSA journey.
Thank you everyone for being here today, and we look forward to meeting you again to add to it to be the 5 common health related issues, which cardiovascular happens to be one of them, mental health issues, which has been mentioned by Monira, to be connecting to the menopause, like we talked about, aging generally, musculoskeletal issues as well. So all those will be coming up in next webinar. So it will be good to have you around. Thank you very much for coming today. Thank you for joining us.
Thank you.
Well,
Thank you.
oh,
Sorry,
okay,
Toby, carry on. No, carry on.
yeah.
Everyone is talking.
On a
I'm just-
final note, really, if you're like me who wants to live up to like 180, 200 years, it's very important that we take our health serious, especially our heart health. So basically, if you are like me, you won't want to miss the next webinar, because when you talk about the cardiovascular system, you are practically talking about all systems, because every of the organs in our body make use of the blood, and it comes from the heart.
Yeah.
So definitely I want to live up to 200, so I need to find a way to keep my heart healthy.
Oh my God.
So see you next webinar. Bring someone who you also want to live up to 200, so that the person can join me in the race. Thank you very much for coming.
Great. Thank you so much. Thank you all. We would end the webinar now. We hope to see the next webinar. Have a great day.